right, we're gonna move on to the femur. The femur is typically done in 2 films is what it takes, because you need overlap you need the entire bone, and there's got to be a little overlap between the two. So you're gonna shoot it on 2 different films. So I'll show you. We'll do an upper and a lower. So you want to do bucky alignment. It's always kind of the first thing you do. Make sure your technique's right and your detent's right. So this is all set, and then you can just kind of adjust your patient. So for this, to put the femoral next in profile, the patient needs to immediately rotate their leg. So go ahead and take your right leg and turn your toe in a little bit. If they have trouble doing this on their own, then you can just have them roll them both together and tape their toes together over their shoes, and then they don't have to support it themselves. So what you're going to do is, to get the superior portion, palpate the ASIS. It's always my starting point. So my film will typically go at the point of my ASIS and come back just a tad there, just like that. And then I can imagine from the ASIS to the pubic symphysis, right in between is the femoral head, right there. So I'm going to get a little bit above it. That comes down the neck at an angle. Greater trochanter's over here, and then the bone kind of comes down like that. So I might go to the inferior portion of her ASIS with my light field, just like that. Now I know I've got all this. The bone's going to be right under my center photocell. That's going to be my proximal AP femur. Obviously, I'm going to cone in just a little bit and get my marker in there. For some people, though, getting your marker in there, it may have to go on the film, because their thigh will take up this entire light field, and the bones are still the same size. The bones are little. It's just there's a lot of extra meat for people. So that's my AP proximal. And my distal can be really similar. I swap out my cassettes. I use my finger to mark for overlap, and I just shift down to include the knee joint, like that. Just like that. And you may straighten it out because it's going to look a little prettier that way. It kind of depends on preference. But obviously, you change the orientation a little bit when you do that. You can shift the leg like that. But the big thing is you want there to be a portion of the upper on the lower film and a portion of the lower femur on the upper film, so that the doctor can be assured that they have the entire long bone with no gaps in the middle. So that's the AP. So then, now we'll do the lateral upper and lower. So this one's a little trickier, and it's a lot like the hip, but for this one, I'd have my patient, can have you scoot to your left a little bit. Now, for little old ladies, they'll get scared moving on this table because they feel like they're up in the air, and if any patient has ever fallen, not just little old ladies, but anyone can be afraid of falling off this table. It can be kind of scary. So for the proximal portion, bend your knee all the way up and just let it fall all the way out towards me. So this is considered the frog leg position. Scoot your hips a little bit that way again, just like that. And so for that one, I turn my tube with the axis of the bone. Like this. And again, the ASIS to the pubic symphysis, femoral head is going to be about halfway. So I've kind of got that as high as I want to go. So if I'm crossing the pubic symphysis and the ASIS with my light field, then I can be pretty sure that I'm going to get the proximal portion of the hip. Again, I want to be on bone more than soft tissue, and if at all possible, I'm going to mark anteriorly or laterally. So just kind of throw my marker out here, and that would be my proximal. Now, some people are going to be able to get this so lateral that, and if it was on the table, that I could just scoot them over and shoot my lateral, and that would be sweet. But 90% of the time for this distal, you got to do a big adjustment. So what you do is, all right, now I need you to lay all the way on your right side. So swing your whole body up and just kind of get snuggled into your right side. Scoot your hips back. So again, for Jill, notice she was able to just get that leg, and then you drop it down a little more, very lateral, and you're good to go. Not everybody's going to be able to do that, so there's a definite variation. Can I show them?
Yeah.
Okay. So for that one, swing that back leg all the way over the front. Just kind of pull it up. Some people are going to need to do this, and it's going to allow their hips to roll forward enough to get this leg down. Go ahead and relax. So that's basically it. Get it on the side, throw the marker there. You know you've got overlap because you continue to use a 14x17, so that's the upper and lower. Same principle as the AP. There you go.